Good day, everyone. I am Mabel J. Shesin, and I am the reporter of the topic Community Violence and Resources for Prevention. What is community violence? Community violence affects millions of people and their families, schools, and communities every year. People's health outcomes are influenced by the conditions in which they live, work, play, and learn. These conditions are called social determinants of health: systematic racism, bias and discrimination, economic instability, concentrated poverty, unlimited housing, education, and healthcare access drive health inequities such as violence. Community violence also happens between unrelated individuals who may or may not know each other, generally outside the home. Examples include assaults or fights among groups and shootings in public places such as schools and on the streets. Research indicates that youth and young adults ages 10 to 34, particularly those in communities of color, are disproportionately impacted. Community violence can cause significant physical injuries and mental health conditions such as depression, anxiety, and post traumatic stress disorder or the PTSD. Living in a community experiencing violence is also associated with increased risk of developing chronic diseases. Youth and young adults can be victims, perpetrators, or witnesses of violence. People with multiple adverse childhood experiences, including exposure to violence, are more likely to have short term and chronic physical and mental health conditions and behavioral difficulties. Community violence takes lives and leaves a lasting legacy of trauma. It must be prevented. Homicides and other violent acts are causing substantial harm in communities across the country, especially in racially segregated and highly poverty neighborhoods. Rates are increasing. In the last year, homicide rates increased in many areas of the nation. Data shows significant increases in homicide rates in 2020 compared to 2019. Nearly 25,000 lives lost due to homicide. So, how can we prevent community violence? Prevention programs are those that intend to strengthen, empower, and engage people to keep them safe and healthy. These efforts include approaches aimed at reducing factors associated with at-risk, problematic behaviors, and strengthening protective factors. They can be directed toward youth and young adults generally, or more specifically directed towards at-risk populations within the community. First is engage community members in prevention efforts. Community leaders can work collaboratively with community residents and those impacted by violence, such as young people with life experience of violence, to develop violence prevention efforts. Partnering with community members to select, implement, and monitor prevention activities helps ensure that the efforts are community driven and effective at preventing and reducing community violence. Second is youth development. These programs focus on engaging young people to develop their emotional, physical, social, and intellectual selves. Programs like these provide opportunities for youth to practice conflict resolution and pro-social life skills. Promising programs includes the Life Skills Training Program. Next is the street intervention or interruption, active outreach, and engagement. These programs target at-risk youth to provide crisis intervention and de-escalation of high-stress situations. Such programs can assist in reducing the threat or perceived threat that can increase risks for violent occurrences. Next is the counseling and therapy. These programs reflect developmentally appropriate therapeutic services provided by a mental health professional. Effective programs incorporate cognitive behavioral therapy and include contingency management approaches. And the last is case management. Case management programs support youth and their families in identifying and accessing resources. Individuals at risk for involvement in street level violence can be difficult to engage in services. Case management approaches that actively engage youth and families, which includes active outreach in home meetings with youth and families. Community engagement are more effective than more passive approaches, which require youth and families to meet in office locations. Even though we are getting less violent overall, it is not good enough in a civilized society to accept the level of violence present in our society, nor how unequally that violence impacts on our citizens. Not one of us, no matter where we live or what we do, can be certain who will suffer from the next act of violence. The victims are black and white, rich and poor, young and old, famous and unknown. They are, most important of all, human beings whom other human beings love and needed. So that would be all.